If your therapist has indicated that you excessively use your jaw muscles during your normal day-to-day activities, then here are some exercises to do to self-release the pterygoid muscles and the masseter muscles in the jaw. The first thing to do is to get yourself a baseline. So we're going to see how wide you can open your jaw by placing fingers side by side, whether it's to one finger, two fingers or three fingers. For me, I'm quite tight through these areas, so I can really only open to 2 finger width, just a little bit more. Okay, so the first thing you can do is to start getting the movement going in your jaw, is to move it from side to side. This just gets these jaw muscles that we're going to work on to start releasing a little bit on their own, which obviously cuts down any discomfort that you're going to feel. So nice and loose, wiggling from side to side. Okay, what we're going to do now is try and find the TMJ, the temporomandibular joint. If you go from the corner of the eye to the base of the ear, you'll find at halfway through a little groove, indentation. It's almost where you start to sort of naturally rub the temples when you're getting a bit of a headache. So using 1 or 2 fingers, give it a nice little rub for about 30 seconds into that area. It may be uncomfortable, side to side, up and down, and in a circle. Next, we're going to go into the zygomatic and the pterygoid. So just tracking down underneath the cheekbone into this region here, you're going to work in a diagonal pattern between the mouth and the top of your ear. Again, about 30 seconds. Now the next one we're going to do is really working into pterygoids and masseter. So what I want you to do is to just clench your teeth and feel for that tightness to occur in there. Okay. Relax the jaw so you're not clenching anymore, and using 1 or 2 fingers, again, deep circles, rubbing up and down the jawline, backwards and forwards, until any discomfort eases and you can feel that tight muscle starting to relax. Remember to do both sides. We always work on both sides, even though you may have a problem one-sided. And then we're going to do a nice stretch of the jaw. To do this, you need to put your thumb underneath the jaw, the top teeth, and your opposite index finger on the bottom teeth. And then you're just going to prise them apart and really feel the stretch taking place at this area. Hold it for about 30 seconds, and then let's recheck the baseline. So for me, I only do one side and very short time, but I can see some difference, and I can feel the difference here as well, starting to release. Now, if you do this on a daily basis, you will start to create more movement in the jaw. So any disruption on the TMJ joint here will start to balance out, but also you release any overcompensation patterns that your therapist has diagnosed that involve the jaw.